This is the first program in the series Finding, Organizing and Using Medical Information, created by the Network of African Medical Librarians and Deans with support from the U.S. National Library of Medicine, Bethesda, Maryland.
Hello, my name is Grace Ajumo. I'm a medical librarian at Ilatunde Odeku Medical Library, College of Medicine, University of Ibadan. Are you a student, a healthcare provider, a faculty member, a researcher or scientist? Whatever category, you need information to address your needs and be able to effectively and efficiently carry out your duties. To address your information needs, you should be aware of the sources of information available. And that is the purpose for this module. And I will be discussing information sources. There are three major types of information sources. These are primary, secondary, and tertiary. And these sources are in two major formats: print and non-print. These sources are being created by individuals, government departments, institutions such as universities and research centers, by international organizations, by commercial outfits, as well as professional bodies such as professional associations. So what are primary sources of information? These are original documents, manuscripts, reports, memos, interviews written by people who have first-hand experience or who witnessed the event. Examples of these are technical reports, photos, artwork. Also, a journal article describing a researcher's invention of the vaccine to prevent HIV and AIDS. HIV infection will be a primary source of information. The speech delivered by Nelson Mandela during his inauguration as the first black president in South Africa will be a primary source of information. A video showing the civil unrest in Libya will be a primary source of information. A newspaper report the bomb blast in Abuja, Nigeria, during the country's 50th independence anniversary will be a great source, primary source of information. So what are secondary sources? These are not original documents. They are sources that interpret, they evaluate, they comment, they criticize primary sources. Examples are commentaries, criticisms, and dictionaries. A magazine that critiques an artwork is a secondary source of information. If a reporter writes on the speech made by Nelson Mandela during his inauguration, it's no longer a primary source of information. It is a secondary source. We have tertiary sources. These are sources that index primary and secondary sources of information. An ACT index is a tertiary source of information. So where do we find these sources of information? We could get information from our friends, from peers or colleagues, from the libraries. Libraries collect sources that are peer-reviewed and make this available to their patrons. Also, archives are places where records of enduring values are made available and preserved for researchers. The internet is also a huge source of information. The good, the bad, and the ugly are there. There are different categories of information sources. We have abstracts and indexes. We have biographical sources. We have bibliographies, drug information sources, the grey literature. We also have monographs, periodicals, including journals, magazines, newspapers, and newsletters. Also our reference sources, and we have databases. Talking about databases, We have bibliographic databases, including Medline through PubMed. This is free on the internet wherever you are. If you have access to the internet, you can search Medline and obtain relevant, up-to-date information. We also have other databases such as Scopus, Web of Knowledge, and Embase. Some of these are free through Hinari, while the others are based on subscription. We also have the African Index Medicus. If you are looking for local content, that is where to go. Search African Index Medicus. Some of the articles are full text, have full text, while others are abstracts. You would not regret you visited that site. We also have great literature and also internet portals, web pages that provide you access to huge amounts of information. Social networking applications are now being heavily used as means of sharing information. We have YouTube, we have Twitter, we have Facebook, and librarians are increasingly using these sources to reach out to their users. If you need information about current political situation in any country, including your country, try the newspapers or the web, or watch cable television. You will be able to obtain good information. If you are interested in research articles that have to do with cyanide in cassava, try the databases. Search PubMed. You are going to find peer-reviewed journal articles that discuss cyanide in cassava or how to use cassava flour for baking. If you are interested in finding out scams on the internet, try to search magazines or e-magazines. If you are interested in scholarly articles that discusses issues like HIV and AIDS in Africa, search African Index Medicus, search Medline, or you go to Scopus, you will find peer-reviewed articles discussing these subjects. Also, if you are interested in general information, maybe how to make ice cream, or you are looking for contact information of a friend or institution, try Google. You won't regret you did. And if you have difficulties getting the right information, take a step, visit a library, request to see a librarian, and you'll be glad you did.
Please see all the 7 training programs in our YouTube series.